A woman may also be given medication so that the process can be accomplished a lot faster and help her to begin the recovery process sooner. Hello and welcome back to Nurse Onyi Teaches. My name is Onyi. If this is your first time here, you are most welcome. And if you are one of my returning viewers, thank you for coming back again. Make sure you look around at some of the other content, as I believe it'll be of benefit to you. Now, a lot of women have reached out to me asking about miscarriages, what are some of the causes and ways that they can treat it. And I think it's a very important question to address. So in today's video, I am going to be talking about what are miscarriages, some of the different types, some causes of miscarriages, and then some of the signs and symptoms that a woman may experience. Now, while I'm on the signs and symptoms, it is very important to note that emotional burdens such as sadness, anger, and grief frequently follow miscarriages. So if you are dealing with any of these, make sure you reach out to a healthcare professional or somebody in your community that can help you deal with that. Or you can even message Nurse Onyi on Facebook, and I will be more than glad to spend some time chatting with you. And then after talking about some signs and symptoms, we will talk about ways that miscarriages are treated and some things that women can do to prevent them in the future, as miscarriages certainly can have a bearing on a woman's future pregnancies. Without further ado, make sure you stay tuned in and let's go. Well, a miscarriage, also known as a spontaneous abortion, is the unexpected loss of a baby before a woman reaches the 20th week of pregnancy. Now, as previously mentioned, a miscarriage occurs in upwards of 50 to 55% of all pregnancies. And a lot of times women have a miscarriage and they think it is their monthly menstrual period, because miscarriages tend to happen in those first few days following conception. Now, there are many different factors that determine how long it takes for a woman's body to get rid of all the products of conception. So miscarriages can take anywhere from a few days to a few weeks to completely be cleared out of the uterus. There are many different types of miscarriages, and this video by no means covers all of them. But some of the more frequently encountered types include something known as a missed miscarriage, where a baby dies in the womb and just stays in the uterus. And then there's something also known as a recurrent miscarriage, where a woman has 3 or more miscarriages in a row. And we'll talk about why that number 3 is important later on in the video. And then there's something called a threatened miscarriage, where a woman's body has all the signs like she is having a miscarriage, but the baby continues to grow and thrive in the womb. Now, a threatened miscarriage can convert into an inevitable miscarriage, where the fetus dies and then begins to be removed from the uterus. Now, in a situation where an inevitable miscarriage occurs, it can either be complete, where all the products of conception gets flushed out of the woman's uterus and body, or it can be incomplete, where her body and her uterus retain some fragments of the conception, and then that would need further exploration by a medical professional. Now, there are several causes of miscarriages, and the ones discussed in this video by no means cover all the different kinds. Some of the causes include an ectopic pregnancy, where a fertilized egg implants outside of a woman's uterus. Another cause is low pregnancy hormones, and if your hormones are not high enough, then pregnancy cannot be adequately supported. There's also something known as a molar pregnancy. It seems like a baby is forming, but rather it is a mole that is not cancerous, and that mole continues to secrete pregnancy hormones and convinces a woman's body that she is carrying a baby. Maternal age can also be a factor, where women who are younger than 15 or older than 40 have a higher chance of experiencing a miscarriage. There's also something known as a blighted ovum, where the sac will develop but there is no embryo in the sac. Other causes include cervical incompetence, where a woman's cervix, instead of staying nice and closed throughout her pregnancy, starts to dilate in the early parts of pregnancy, and that can lead to miscarriage. Other things like fibroids, uterine scars, any kind of uterine deformity can lead to a miscarriage. And then women who have diseases such as high blood pressure or diabetes and different things of that sort can also experience changes that can affect their pregnancy and lead to miscarriage. And women who use alcohol or smoke during pregnancy, or are even exposed to secondhand smoke and other type of illicit drugs, can also experience a miscarriage. Some of the signs that a miscarriage is happening include vaginal bleeding. Now, that bleeding can be light or it can be heavy depending on how advanced a woman is in her pregnancy. And the color of the blood can either be reddish or brownish depending on how quickly or how well the uterus is expelling the products of conception. Another thing moms deal with is cramping pain and back pains almost simultaneously. That cramping pain can feel like the ones a woman experiences during her menstrual period, or it can downright feel like contractions. This is because depending on how advanced the pregnancy is, the uterus may need to work more to effectively begin to remove the products of conception. Another thing that many women who are advanced in their pregnancy will deal with is the loss of fetal movement. A lot of times moms have felt something known as quickening, and with the demise or the death of a baby in the uterus, that movement will cease. A medical professional or maybe people with a Doppler at home will also find it very difficult finding a heartbeat on the baby. Another sign is the passing of blood clots or tissue from the vaginal area and the uterus, just to sort of clean things out and reestablish homeostasis in the woman's body. And last but not least, a lot of women who have been dealing with a lot of pregnancy signs such as nausea and vomiting or very high sensitivity to smells like that will notice that some of those signs go away, and that's another sign that a miscarriage is happening. Now, once a miscarriage has begun, there is really no way of stopping it according to current medical knowledge. So the best thing for a medical provider to do is treat the type of miscarriage in front of them. Now, a threatened miscarriage is not a miscarriage. It is the body threatening to begin one. So in that situation, your doctor or your healthcare provider may advise you to practice bed rest and pelvic rest. You will be told to limit your activity so that if irritation is the cause, then that can help stop it and send that away. There is no proof that bed rest or any sort of pelvic rest can lead to the stoppage of a miscarriage. But if a woman can do anything that would help her to any degree, it is certainly advisable for her to do so. Now, in the case of an inevitable miscarriage, it may be incomplete or complete. If it is incomplete, where some of the products of conception are retained in a woman's womb, it may be necessary to do a D&C, or something known as a dilation and curettage. And this is a situation where a doctor will go in and open up a woman's cervix and gain access to the uterus, and then a curette is used to scrape out all the products of conception, and they are effectively expelled from the uterus. A woman may also be given medication so that the process can be accomplished a lot faster and help her to begin the recovery process sooner. If a woman experiences a complete miscarriage, it is still very important for her to follow up with her healthcare provider. That'll give your doctor or your nurse a chance to check you up, make sure everything is good, and then also give you an opportunity to discuss some of the emotional things that you may be dealing with following a miscarriage. Now, in a situation where a woman experiences recurrent miscarriages, that is 3 or more miscarriages in a row, it is very important for her and her partner to have a very serious conversation with their healthcare provider. This is because 3 or more miscarriages in a row frequently indicate that if a woman gets pregnant again, there's a chance that it can also end in miscarriage. You need to sit down and have a heart-to-heart with your doctor and discuss things like your genetics, some of your health issues or social factors that may be causing miscarriages. And if these things can be treated, then those treatment modalities can be put in place to enhance a woman's chance of conceiving and sustaining a pregnancy. Now, while it is difficult to say that a miscarriage can be prevented 100%, there are some things that women can do to increase the likelihood of starting out healthy in their pregnancy process and increasing the chances of sustaining the pregnancy to full term. And that includes taking folic acid. When a woman takes folic acid, even before she becomes pregnant, she helps to support the healthy creation of the baby's neural tube in those first early weeks. It is recommended that women take at least 400 micrograms of folic acid, which can greatly increase the chances of their baby's neural tube forming healthily. A healthy neural tube can lead to a healthy fetus and thus a healthy baby during the development process. Another thing a woman can do is exercise and try to maintain a healthy body weight. Too skinny and your body can have issues. too heavy and your body can have issues. It is also very important to limit stress. Stress can throw off a woman's hormone, and when your hormones are not agreeing with pregnancy, it increases the chances that you will deal with a miscarriage. You should also manage any disease processes that you may be dealing with before you even get pregnant. And certainly after you get pregnant, you want to make sure that these conditions in your body do not increase the likelihood of your body rejecting your pregnancy. It is also advisable for women to avoid alcohol, avoid smoking, avoid exposure to secondhand smoke, and definitely do not use any sort of street or illicit drugs during your pregnancy. Even if the pregnancy makes it to full term, there may be some long-lasting effects on the child's development, and those are things that a mom should not have to deal with or expose your child to having to deal with. Now, if you have learned something from the content of this video, make sure you give it a thumbs up. And if you haven't done so already, make sure you hit the subscribe button and turn on your notification bell so that you are made aware of every time a video is uploaded. If you know somebody who can benefit from this content, do not fail to share it with them. I wish you success as you navigate your maternity journey. And until the next time, be blessed.